Use your right hand to examine the left breast and your left hand to examine your right breast. What's up, beautiful people? Welcome to another exciting episode of Ask Dr. 𝐭. And as promised in my last video, in today's episode, I'm going to be telling you how to do a breast self-exam. Okay? So now, in case you missed the last video, breast self-exam is something you do to detect any unusual changes in the breast that might indicate that you may have breast cancer. Now, breast self-exam is not only limited to women. Men should also examine their breasts regularly for any unusual changes, as men can also have breast cancer, even though it is more common in women. And again, like I said in my last video, not only older women need to do this breast self-exam regularly, but even younger women as well, because these days we are getting more younger people being diagnosed with breast cancer every time. So when you want to do a breast self-exam, the first thing you want to do is stand in front of a mirror without wearing any shirt or bra. So basically, you are naked from the waist upwards in front of the mirror. Then the next thing you want to do is place your hands firmly by your side on your hips like this, okay? And then now observe the breast for any changes. You can bend down a bit to see if there's anything pain in the breast or any changes in the size of the breast. Sometimes, like I said, some people have one breast that is bigger or smaller than the other, right? That's not unusual. However, even if you have one breast that is slightly bigger than the other, if you notice any changes in the size, like the bigger one is getting bigger or the smaller one is not catching up with the big one, then you need to see your doctor immediately. Bending forward helps you to see the difference in the size. Now, if you stand straight, you also want to observe if your nipples are pointing outwards or your nipples are pointing inward. The nipples are pointing outwards, that's how they should be usually. But if your nipples are pointing inwards, then it may be a sign that there is something wrong. For some people, this is the normal way that their nipples are. So if that's normal for you, then it's okay. But if your nipples have always been pointing outwards before now, then you might want to see a doctor. Then the next thing you want to look out for is any changes in the skin surrounding the nipple. So if you notice any peeling, any flaking, any scaling, or any redness or soreness in the nipple area, that dark pigmented area that we call the areola that surrounds the nipple, then you need to see your doctor immediately. After that, you might want to change your position, okay, and put your hands behind your head with your two palms pressed firmly together like this, right? And observe for the same changes. Observe for any changes in the size. Observe for any nipple regression, that's the nipple pointing inwards. Observe for any scaling, peeling in the breast. So you're just looking in the mirror basically. So you're just looking in the mirror basically to make sure there are no changes. Now the next thing you want to do is to start to examine the breast. So before we are doing is inspection, now what we are going to do is palpation. So we are using our hands to examine the breast and feel for any lumps in the breast. To feel for lumps in the breast, don't use the tip of your fingers because they are not as sensitive. What you want to do is use the pads of your fingers, and those ones will be more sensitive for detecting lumps. And when you want to examine your breast, you want to do it in a uniform pattern to make sure that you cover all areas of the breast. So I recommend circular motion, and I'll show you just how to do it. Also, when you're examining the breast, use your right hand to examine the left breast and your left hand to examine your right breast. And you can examine it either lying down, sitting, or standing in the shower. Okay, so now I'm going to just examine it sitting down. Now I can put one hand behind me, okay, to give me a lot of space, and I take my right hand, and using the pads of my hand, I start in circular motion. You can choose to start from the nipple and walk outwards, or you can choose to start from out and walk inwards towards the nipple. So I prefer to start from outwards. Start from somewhere around your breastbone. Okay, your breastbone is somewhere in the middle here. So you want to start from there and walk your way round. So remember, I'm not using the tips of my fingers, I'm using the pads. So I'm pressing, and then when you press, you make a circular motion about the size of a coin, a small coin, and then press, make another circular motion. Just pressing to make sure that you are feeling for any unusual lumps. And then you keep pressing around like that. Keep pressing around. Press round So you cover the outside and then you go inside until you get to the nipple area. Now, when you get to the nipple, you also want to make sure that there is no nipple discharge. So you observe and see if there is no discharge, then press your nipple to make sure that there is no fluid that is coming out. If you press and any fluid comes out, then you need to see your doctor. If you press and no fluid comes out, then you are okay. Now, after you are done with examining the breast, then you want to examine the armpit, what we call 𝐦𝐨𝐬𝐤𝐞, to see if there is any lymph nodes. So a lymph node will basically feel like a lump as well. So now to check your armpit for lymph node, you start from down here and go all the way upwards into your armpit. Okay, and make sure you press using the pads of your finger to feel for any lymph nodes all the way inwards. For people that are ticklish, this might be difficult. Make sure you put your hands all the way in. Okay, remember that your hand is still on your head, so you are putting your hand all the way inwards to feel for lymph nodes. Then when you are done with that side, you repeat the same method on the other side. So start from outside close to the breastbone and work your way round the breast. Then press your nipple at the end and then check the axilla for any swollen lymph nodes. So make sure you do a breast self-exam at least once a month. In order to make sure you don't forget, you can set aside a particular day every month when you do it. For example, you can choose the first of every month or the last day of every month, but just make sure it's something that you do regularly. And if you notice any unusual changes, make sure you go to the doctor as soon as possible for a breast cancer screening. I hope this video has made it easier for you to know how to do a breast self-exam. If you have any questions about what we just discussed, feel free to drop a comment in the comment section down below, and I'll be more than happy to answer your question. If you enjoyed watching this video so far, don't forget to click the like button, share and subscribe with someone who is different to you. Actually, subscribe with everyone, because men and women alike need to know how to do a breast self-exam. So till next week, stay healthy.